My tutorial presents schizophrenia. Schizo means split and phrenia means mind. So it is the splitting of mind rather than the splitting of personality. Schizophrenia is a neurodevelopmental disorder caused by abnormalities of brain development that are associated with genetic predisposition and early environmental influences, but they are precipitated by later triggers such as physical or sexual abuse or stressful conditions. The potential risk factor includes genetic or family history. Schizophrenia is more prevalent in first-degree relatives such as twins, viral infections, exposure to lead, neurochemical irregularities such as increase in dopaminergic levels, obstructive complication or prenatal exposure to hunger, and dense or stressful living environment. So again, the risk factor includes genetic factors, environmental risk factors including obstructive complicated history, and overall decrease in brain size, especially a greater reduction in temporal lobe volume, may also lead to schizophrenia. Social stress and cannabis misuse are the other risk factors. The symptoms of schizophrenia are divided into positive symptoms, which are more prevalent in acute schizophrenic attacks, and the negative symptoms that are more prevalent in chronic schizophrenic disease. The positive symptoms include delusions, which are the false belief that a person feels very strong about. This may be the delusion of control or the delusion of preference. In delusions of control, a person believes that his feelings are being controlled by someone else, whereas in delusion of preference, a person thinks that others, including the media such as television or radio, are referring to him, but they are not. Hallucinations, which are the sensations that are only be perceived by the patients, but are not actually present. Disorganized speech, in which a person becomes deficient in making up new words, such as word salad. And the negative symptoms that are prevalent in chronic disease include flattened effect or lack of emotions, reduced speech or alogia, or lack of motivation or inactivation. So again, symptoms are divided into acute schizophrenic symptoms or positive symptoms including auditory hallucinations, but other hallucinations such as gustatory hallucinations, olfactory hallucination, or visual hallucination may also be present. Broadcasting, insertion or withdrawal of thoughts, controlled feeling or passivity experiences, and delusional perception. Whereas the negative symptoms include flattened effect, apathy and loss of drive, social isolation or autism, and poverty of speech or alogia, and poor self-care. The diagnosis is made primarily on the clinical ground. For example, if more than 2 schizophrenic symptoms are present for a duration of about more than 6 months, a person is labeled as schizophrenic. But the other investigations such as electroencephalography, CT scan, or MRI are required throughout the organic brain disease, such as temporal lobe epilepsy or brain tumors. So again, the investigation are focused on excluding treatable causes such as slow-growing tumors, temporal lobes, and the investigations include electroencephalography or EEG, or CT scan and or MRI. Schizophrenia is divided into 4 subtypes. They include paranoid, disorganized, catatonic, and undifferentiated. The paranoid subtype is more common in older age, and it is strongly associated with delusions and hallucinations. But this type has better functioning than the other ones. Disorganized. The disorganized subtype is present in younger age, especially before the age of 25 years, and it is recognized as disorganized behavior, such as poor appearance or poor grooming. The catatonic subtype is characterized as bizarre behavior in which a person is super resistive to moving or activation. And the undifferentiated subtype, in which mixture of symptoms are present. So the paranoid subtypes is present in older age and associated with hallucinations and delusions, whereas the disorganized type is mostly present before the age of 25 years and is recognized as poor appearance, disorganized behavior. The differentials include functional psychosis and organic disorders. The functional psychosis include delirial disorder, psychotic depression, manic episode, schizoaffective disorder, purple psychosis, whereas organic disorder include drug-induced psychosis, side effect of prescribed drugs, temporal lobe epilepsy, delirium, dementia, and Huntington disease. Management. In severe cases, the person is made to admitted to the hospital. And antipsychotic drugs are prescribed. They include typical and atypical. The typical antipsychotic, such as chlorpromazine, haloperidol, and fluphenazine, are more effective in positive symptoms or in acute schizophrenic attack, whereas the atypical generation, such as clonazepam, are more effective in negative symptoms. Psychotherapy, which include reassurance of patient and his family, and cognitive behavioral therapy, in which the person is made to understand his feelings, emotions, and behavior. Social support, prevention of relapses by prescription of prophylactic antipsychotic, proper counseling of patient and his family, and a follow-up, especially in clonazepam cases, as it results in agranulocytosis. So, a regular blood monitoring or CBC is required. There are two main adverse effects of antipsychotics. These include neuroleptic malignant syndrome, which is a medical emergency and is characterized by pyrexia, severe agitation, and muscle rigidity, and it is treated by tetrazoline or bromocriptine prescription, and cardiac arrhythmias, as antipsychotic result in QT prolongation, especially quetiapine. The other adverse effect includes cholinergic-like effects, such as anticholinergic-like effects, such as decreased salivation, urinary retention, constipation, and neurological adverse effects, which include Parkinson-like diseases or effects. These are due to decrease in dopaminergic levels. So, with a proper patient compliance, proper medications, and a psychotherapy, the outcome is good. And about 1/3 of cases have a good outcome, whereas 1/3 develop into chronic schizophrenia. Prophylactic antipsychotic reduces relapses for about 70% of cases. But unfortunately, suicidal effects are present in about 10% of cases. So this is the end of lecture.